I'm going to try to be as clear as possible, and also I'll try to be brief. Ladies and gentlemen, esteemed colleagues and distinguished guests, it is an honor for me to be here and standing in front of you here in Bilbao for the first day of our General Assembly for this EU-JAMRAI second edition. On behalf of France, the coordinating country and its Ministry of Health, I would like to express my sincere gratitude to all of you for your active participation today and your insightful contribution. Today has been a testimony to our shared commitment, our collective expertise, and above all, our determination to combat AMR at our European level. As we know, AMR is a crucial and essential health threat weighing on our shoulders and generations to come. We are all aware that AMR goes beyond a medical challenge. It is a complex cross-border issue with political, economic, and social implications. Indeed, data are alarming, with an estimated 35,000 deaths annually in the European Union alone, with global projections threatening to reach up to 10 million deaths by year 2050 if we fail to act against this silent pandemic. Beyond the human cost, the economic impact also covers the environmental and animal health sectors. But you all know these figures too well, and your presence here today testifies to your awareness and commitment to a holistic approach to combating AMR. In addition, it also confirms that no action can be conducted alone. This is why coordination with the European action is essential. Our fight against AMR must be grounded in a One Health approach, recognizing the intertwinement of human, animal, and environmental health. Policies must strengthen sectors and borders. And this is precisely where the EU-JAMRAI 2 holds its greatest promise. EU-JAMRAI 2 is, of course, a continuation of previous efforts, but it is also a new opportunity to transform strategic ambition into lasting, impactful, and sustainable policies. We have the knowledge, and I believe the energy to embrace all the efforts needed to make Europe a best practice region. But the real challenge and concerns lie in ensuring that our work extends beyond this joint action, shaping One Health national action plans and policy in a sustainable way. EU-JAMRAI 2's value lies in its ability to bridge gaps, and we'll talk about that tomorrow, between science and policies, between national priorities and European ambition, and between short-term actions and long-term sustainability. EU-JAMRAI 2 serves as a catalyst for change, fostering collaboration and mutual learning among member states and associated countries. To achieve this, today's discussion underlines three key pillars. The first one is the One Health integrated surveillance. Indeed, surveillance is the cornerstone of AMR control. Focusing exclusively on human health sector would be detrimental, as the fight against AMR requires an integrated One Health surveillance systems across sectors, considering their close interaction as shown today. Second, antimicrobial stewardship and infection prevention control, known as IPC. Antimicrobial stewardship in both community and healthcare settings, relying on optimized and prudent use of antibiotics in all sectors, is critical to preserve the effectiveness of the existing antibiotics. A joint perspective with IPC programs will ensure that infections are contained at their lowest level, but also that antibiotic resistance remains limited, resulting in better clinical outcomes. Together, they represent cost-effective strategies that reduce the burden of AMR on all health systems. Third and last, access to antibiotics. Access is not only a matter of availability, but also equity and sustainability. We must ensure that current effective antibiotics remain accessible to all those who need them while preserving their efficacy, both for human and veterinary use. This requires strengthened supply chain, but also incentive for innovation of new drugs and affordable pricing models that do not compromise future access for the largest numbers of countries. Let us be clear. The fight against AMR requires a long-term commitment. EU-JAMRAI 2 offers a framework, but its impact will definitely depend on how we implement and adapt its outcome at national and EU levels. Meanwhile, the clock is ticking, and we have already devoted a quarter of the time allocated for this joint action ending in 2027. Therefore, we are urged to transform our discussion into concrete actions and our strategies into sustainable policies to reach the 2030 antimicrobial resistance target set by the European Council. Indeed, today's sessions have already shed a light on what we are building together and what we must ultimately achieve. Ladies and gentlemen, as we close the first day of our General Assembly, let me remind you that every idea and every partnership forged here brings us one step closer to a future when we can expect a limited AMR burden. Together, through EU-JAMRAI 2, we can make AMR not just a challenge we face, but a crisis we overcome. Thank you very much.